Number 3, Kenneth Gibson.
Thank you, Presiding Officer. To ask the Scottish Government whether it plans to integrate gender identity and mental health services.
Minister Marie Todd.
We remain committed to improving access to and delivery of NHS gender identity services. That's why we published a framework in December 2021 with a range of actions for that purpose. Many of these actions are now well underway. That's why we're also allocating funding to health boards to directly support these clinical services. The services will be already be able to connect patients into local mental health services if required following clinical assessment. Finally, we're working to create a mental health system that responds to everyone's needs. That means mental health services and support being person-centred. That includes supporting transgender and non-binary people with a whole range of issues, including gender identity, which might impact on their mental health.
Kenneth Gibson.
I thank the Minister for that reply. Does she agree that many young people who present at gender clinics have concomitant complex psychological and mental health needs? Once someone is identified as having gender-related distress, other important health issues can be overlooked in favour of an unquestioning affirmative approach to transition. What support is available for people seeking to detransition, and can she share with the Chamber the protocol for dealing with this vulnerable patient group?
Minister.
So, following clinical assessment, health services are able, as I said, to connect patients into local mental health services if required. And I can assure the member that the Young People's Gender Service delivered by NHS Greater Glasgow and Clyde works closely with a range of other services, including local child and adolescent mental health services. Public discussion about this type of healthcare can unfortunately be polarised, leading to misconceptions about how it's delivered. In NHS Scotland, best practice is expected to be grounded in the principles of realistic medicine. This framework supports patients and registered medical practitioners to have honest and open conversations about healthcare. It promotes shared decision-making and a personalised approach to care. Now, detransitioning can generally be understood to be the process of reversing social, medical or other steps towards transitioning and returning living to one's sex at birth. And in cases where an individual might decide to halt or reverse aspects of a medical transition, they would be appropriately supported by their clinical team to do so. And health professionals will, of course, understand that the reasons behind any decision to detransition will be varied and incredibly personal, and they'll respond appropriately.
Brief supplementary, Sue Webber.
Thank you. The Scottish Government has described the current process for obtaining a gender recognition certificate as overly medicalised and is proposing to remove the requirement for medical evidence to change one's legal gender through the Gender Recognition Reform Bill. The Sandiford Gender Identity Clinic in Glasgow is currently offering initial appointments to patients that registered 3 to 4 years ago. So do you agree that the real problem facing trans people is a lack of timely medical care and support? And what does the Scottish Government plan to do about these sky-high waiting times for patients experiencing gender dysphoria?
Minister.
So, let me agree there is undoubtedly a real challenge in delivering gender identity services, and the waiting lists are far too long and people are waiting far too long for the care that they require from NHS Scotland. We have a great deal of work going on that front. I think if the member would care to look in the interest of time at the letter that the Cabinet Secretary has provided to the committee inquiring into that particular piece of legislation, at the moment you'll find the answers to all of the questions that you've asked in terms of the range of work that's going on to improve the services on the ground.
Thank you.